Today we're going to talk about the concept of filler fatigue. There's a lot flying around on social media, the internet, in Hollywood, all of this, that filler is out and that people are ruining their faces with filler, and there's a lot of misunderstandings. There is some truth in that, but there's a lot of ways to get to how you gain insight into that truth. And we are going to have a discussion today that leans into that a little bit.
Certainly patients, I think, are confused at the very least. And I actually don't think that this discussion is any different than the discussion that was flying around a few years ago about surgery. How nobody wanted surgery because everyone saw bad plastic surgery and people looked like they'd been in the wind tunnel and their eyebrows were halfway up their forehead. And the whole idea was, oh my gosh, you got to avoid surgery. And people started working with fillers. Problem is, and you mentioned something earlier as we were talking about, is that there's really no barrier to entry. I mean, at least to become a surgeon, you have to do a certain amount of training.
Right.
To inject filler, you have to basically go to a weekend course and find someone who's willing to place an order with the vendor, and anyone can do it, which doesn't mean they know that much about what they're doing. The reality is, just because you know how to do surgery also doesn't mean you know how to inject filler well, which is another whole discussion probably. But I think fillers are like, and I tell patients this all the time, it's like any other product or procedure, whether it's a laser, whether it's surgery. If it's done well, it should be not noticeable and it should look great. But when it's done poorly or overdone or underdone, people are going to be unhappy. I think that that's just somehow in all of the drama on social media, that kind of gets lost.
Well, I think the other side of it too is an understanding of, and also what we tell patients is that this is truly a blend of art and science. There are true scientific points to understand and respect, but then there's also everyone's artistic style and ability, and whether you can translate what you see in your mind into reality. And I think there's some of that I think gets missed along the way. And I tell patients that for every patient or every person you see wandering around that looks like they've completely messed up their face with filler, one, it's not always just filler, but two is that you've got 10 people behind them that have a face full of filler that you'd never even know that they had it.
That's very true. I think one of the mistakes people made early on was based largely on the way clinical trials were done. Patients would be followed for 6 months initially. Now they followed for 12. So the messaging sort of was, well, the fillers last for 6 months because no one bothered to follow them for 12 or 18 or 24 because it's expensive and takes a long time. No one wants to wait 2 years to get their studies out there. But the reality, so people would get injected every 6 months. And these products last a really long time. And most of the people that you reference walking around who look overdone, it didn't happen because they went to someplace and they got a zillion surges of filler all on the same day. Most of it is because they got a little bit, they said, oh, pretty good. And then they got some more. They went in every 3 months for their Botox, and they figured, I better get a little bit more filler. And people who didn't know better would keep putting more and more filler in. And after several years, they just looked.
Yeah, I think there's that. And I think something that we've also, grown to where we're really good, I feel like, about saying no to people when either they have had enough, or the other side of it is when things get thrown out of balance. And that's really where things start to stand out and not look right, is where the lips are out of proportion with the rest of the face, or the cheeks are too wide, or things like that, or things start to just look, again, out of proportion, to where I think that's also a thing that stands out.
Well, it's a great point that you're bringing up, is that you do have to look at the whole face. And what we see too often is someone went to an injector who knew how to inject lips and cheeks. And their lips and their cheeks are really full, but they're way out of balance with the rest of their face.
Exactly.
they need something in their chin, they need something here, they need something here. They just don't look right.
Right.
And you're not even sure why, but they don't look right. Whereas if those patients get balanced out, they can look a lot better. But you have to understand the anatomy. You have to understand how to use the products.
Sure.
And look, I mean, like we talked about in the intro, you spent a year learning how to inject, and you have the advantage of going to surgery and seeing the anatomy in surgery. And I remember we used to say, let's take a needle and stick it to this depth, and this is what it looks like, and so forth.
Yeah.
So it really helps to have that real world understanding of anatomy, because filler is really just about understanding anatomy and aesthetics. If you don't understand the anatomy, there's no way you're going to get the aesthetic outcome.
Agreed. And with that, with the anatomy, is understanding that the face is very well constructed and has little compartments all over it. And when you breach these boundaries that are naturally set for everybody, and granted, we all have the same things, there's just variations from person to person, but when you breach those anatomical, basically, fences, things start to not look or behave as they should. And I think in the field of aesthetics, and especially of things to come, I think people are paying more and more attention to the anatomical structures, where they are, what their limits are, and really dialing back on how much filler you even need to use when you really respect the anatomical landmarks, the boundaries, and all of that, that you can achieve beautiful results with little bits of filler all over the face, which can seem sometimes, I think, intimidating to patients to think that they need so many things, but it's a matter of the right amounts and the right locations to achieve the objectives that you really want, which I think is something that for people who don't fully understand that, or who get into the mindset of more is more and more is better, or that more filler in the cheeks is going to lift and lift and lift, when that's not the objective and anatomically can't be done.
That's exactly correct. It's strategic placement of not necessarily huge volumes. And if you think about it, a syringe of filler, whole syringe is only a fifth of a teaspoon. So it's not very much. So even if someone has 3 or 4 syringes of filler, it's less than a teaspoon. So it's not a lot. And we're talking about the HA fillers.
Right.
Um, so I think that you're exactly correct about adding, but we haven't really talked about taking it away. Some people were overtreated, and some of the fillers that we knew they injected beautifully and they looked really pretty for a while, but they hang around for a long time, and as they start to break down, they start to swell, and as they swell, people start to look puffy. That was another issue, and some of those patients just need to have the filler removed and dissolved. And I think understanding where the filler is located so that we can see exactly where it is using ultrasound, and figuring out how to take it out with the least amount of product to dissolve it, I think has been another big breakthrough that we've had. So we don't have to wait until that filler that looks so bad goes away. That's treatable.
Right. And that in and of itself is not something to be feared, because I think a lot of people are afraid to have filler dissolved, because on the other side of it is that, people start to feel like they get stuck with it, where they're afraid to have it dissolved because they hear horror stories of what it's going to do to your face if you dissolve it, which I think is also misunderstood, to where, hyaluronidase, which is the enzyme that breaks down hyaluronic acid based fillers, is not going to destroy or prevent your own hyaluronic acid in your skin to be functional, or destroy anatomic structures or things like that around it, or cause issues or problems as a result of putting that in there.
Our bodies are always making its own hyaluronic acid.
Right.
So you don't have to be afraid of it, but sometimes you just need to dissolve filler. And sometimes, to the point of your earlier comment on balance, you can't necessarily achieve balance by adding more and more and more. If someone has just been way over injected in one area,
right,
you got to take some out. There are ways that I think, have both found to tactfully and without making anyone feel badly suggest, I think maybe the best place to start would be bringing this down a little bit so then we can add less elsewhere to put things in balance. Rather than
Right.
say, oh, well, you look terrible with those injections. Like, what were you thinking? But
They're like, thank you very much and goodbye.
and people, they actually don't necessarily know that they don't look good. And especially
Right.
if you get a group of people and they all go to the same person for injections and they all kind of look the same
Right.
type of crazy, they think that that's kind of what you look like when you have filler.
Right. Right.
And I think sometimes you just got to find a way to tactfully say, let's shift gears a little bit.
Yeah.
Look at it differently.
No, I don't disagree with that. But I think that there's an approach that we tend to take into account that's a lot more comprehensive in the sense that filler is not the solution for all things. And I think that there's also, like I was saying earlier, that I think people think that filler has the capacity to lift up so much more than it actually does. And I think the combination of whether it's the combination of surgery, the combination of non invasive skin tightening, the combination of Botox or neuromodulating type drugs, utilization of fillers, all of those things as a collective, really good skincare products, all of that is what creates that natural beauty because our faces change in a multidimensional way that if you just use one tool to try to fix everything, you're going to look odd. It's just, there's no way around it because you have to come at it from all the different ways that the skin changes, how the muscles affect the skin and reflect in terms of lines and wrinkles, the changes in volume, changes in the bony skeleton, all of that happen over time. You have to kind of address things. And I think when it's time to do something surgical, you do something surgical, but that doesn't mean that you don't ever get, neuromodulators or filler or laser ever again. It's that comprehensive approach that happens continuously over time is what gives people the most natural look. But I think filler alone has, gets a bad rap. But again, everything happens in cycles and trends. And, it's like when things start going sideways and the snowball starts getting a little off course, then everybody veers away from that. And then all of a sudden it's all, surgery is the big deal right now. And so when all of a sudden something starts happening with that, it's going to back to something non-surgical, and it just goes up and down. And just like with so many other things, it's like,